How to cure a viral infection with home remedies. While there is controversy in the scientific and medical worlds over whether viruses are even live organisms, there is no controversy that viral infections cause a wide variety of diseases, chronic conditions, cancer, long-term illness, suffering and death. There is also controversy about whether some viral infections are ever cured. There are many viruses that survive in human cells with long-term and chronic consequences, and most viruses are difficult to treat because they are protected by the host's own cells. Viral infections can be acute, chronic or latent, waiting for various periods of time in a sort of hibernation until their replication is triggered. Viral illnesses can be uncomfortable and cause you to miss a few days of productivity, but they are generally treatable at home. Using herbal remedies and giving your body adequate nutrition and rest are approaches to fighting off viral infections. Method 1: Reducing a fever without medication. Let the fever do its work. It is not well appreciated by most, but fevers are one of the body's main defenses against infections. Let a fever run as long as possible without too much discomfort. Fever is most often a symptom of an infection but can also be caused by inflammatory conditions, thyroid disease, cancer, vaccines and some drugs. Temperature is regulated by a small gland located in the center of the brain, the hypothalamus. The thyroid gland also plays a role in body temperature. Body temperature can vary throughout the day, but a normal temperature is considered 98.6 degrees Fahrenheit or 37 degrees Celsius. During an infection, the infecting agent produces temperature-increasing substances called pyrogens. Some pyrogens are also induced by the immune system. These pyrogens tell the hypothalamus to increase body temperature. This in turn stimulates the immune system to be more effective at fighting off an infection. Higher body temperature is believed to kill off infectious agents as well. For adults, most fevers are not dangerous and you can let the fever run its course. If the fever is sustained at over 103 degrees Fahrenheit or higher for more than 12 to 24 hours, consider calling a physician. Be cautious about higher fevers. While you can allow a fever to run its course, there are limits to how high you should let a fever go. For infants younger than 4 months old with a rectal temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher, immediately call your physician for advice. For children of any age, if their rectal temperature is 104 degrees Fahrenheit or higher, immediately call your physician for advice. Any child 6 months or older with a fever of 103 degrees Fahrenheit by measuring on the forehead, ear or armpit, should also be seen. Seek immediate medical care if fever is experienced with severe symptoms. It is recommended that if your child has any fever along with any of the following symptoms, call your doctor as soon as possible. Looks sick or has no appetite. Is very fussy. Is drowsy. Has obvious signs of infection, pus, discharge, streaky rashes. Has a seizure. Has a sore throat, a rash, a headache, a stiff neck, an earache. In very young infants, if the soft area on the top of baby's skull is bulging, take a lukewarm bath. Start off by drawing a lukewarm bath. Have the person with a fever get in and relax while the temperature of the water slowly drops. Because the temperature of the water drops slowly, the person cools down slowly as well. You don't want the water too cool because you don't want to drop the body temperature too fast. Wear wet socks. This treatment is a traditional naturopathic approach. The theory is that cold feet stimulate an increase in circulation and an increased response from the immune system. The result is that the body expends heat and ends up drying the socks and cooling the body. This treatment can relieve chest congestion as well. The wool socks, by the way, serve as insulation. This method works best overnight. Use a pair of cotton socks long enough to cover the ankles. They should be pure cotton because cotton absorbs a lot of water. Thoroughly wet the socks in cold running tap water. Wring out all excess water and put the socks on. Cover these cotton socks with wool socks. The wool socks should be pure wool because this supplies excellent insulation. The person wearing the socks should be covered with a blanket and rest in bed for the rest of the night. Most kids will be pretty cooperative because they should begin to feel cooler within a few short minutes. Cool the head, neck, ankles and the wrists. Take 1 or 2 hand towels and fold along the longer axis. Soak the towels in either very cold water, or, if desired, ice water. Wring out the excess water and wrap the towel around your head, around your neck, around your ankles or around your wrists. Don't use the towels over more than 2 areas. That is, use the towel around your head and your ankles or around your neck and your wrists. Otherwise, you may cool down too much. The cool or cold towels draw heat out of the body and can lower the body temperature. Repeat when the towel is dry or not cool enough anymore to give relief. This can be repeated as often as needed. Method 2: Giving your body adequate energy. Get plenty of rest. While it is not always easy, getting rest and staying restful is important in getting over a viral infection. Your body's immune system is trying to do the necessary work. It can't do this successfully if you are using energy for work, school or taking care of someone else. So, stay home from work, keep children home from school and keep your activity level low and as easy as you can. Feed your body with light foods. You probably have heard the phrase feed a cold, starve a fever. Try chicken broth or chicken soup with just some rice and some vegetables. Focus on fresh fruit rich in vitamin C. Eat plenty of fresh fruit such as berries, watermelon, oranges and cantaloupe. These fruit are also rich in vitamin C, which can help fight infections and lower fevers. Eat yogurt. Try either plain or flavored yogurt that contains active cultures of bacteria. These intestinal bacteria have been shown to be essential for a functional immune system. Include protein in your meal. Make sure you include a good and easily digested source of protein such as scrambled eggs or chicken. For example, you can add a few pieces of meat to your chicken broth. Avoid heavy and fried foods. Avoid foods that are heavy, fatty or oily like barbecued or fried foods. Avoid spicy foods like chicken wings, pepperoni, or sausages too. These are too hard on your system when you're ill. Try the Brat Diet. The Brat Diet is often recommended, especially after a stomach virus. This consists of gentle and easy to digest foods, including bananas, rice, applesauce, toast, whole grain. Eat foods rich in zinc. Zinc has been shown to reduce the length of time one has a cold. Food sources of zinc include seafood, beef, chicken, yogurt, beans and nuts. Method 3: Staying hydrated. Drink plenty of water. Fever can lead to dehydration and you want to make sure you avoid this. It will only make you feel worse. Kids, and you, might enjoy frozen popsicles as well, but you do want to avoid too much sugar. Try making popsicles from herbal teas such as chamomile or elderberry. Frozen Italian ices or frozen yogurt or sherbet may be good choices as well. But don't forget plain water. Try an oral rehydration solution such as Pedialyte or Cerelite. You may want to consider using an oral rehydration solution for young children like Cerelite, Pedialyte. Call your physician before you do, and ask their advice. Be prepared with a list of symptoms and about how much your child has been eating, drinking and how high their fever has been. Also keep track of how often you have to change diapers or, for an older child, how often they have to urinate. Keep breastfeeding your baby. If your baby is suffering from a viral infection, it's a good idea to continue breastfeeding as much as possible. This provides food, water and comfort to your baby. Monitor for signs of dehydration. Call your physician for advice even if you are just seeing the signs of mild dehydration, especially in babies. These can progress to more serious dehydration pretty quickly. Some symptoms of mild dehydration include dry, sticky mouth. In a baby, look for dry lips or crustiness around the lips, eyes. Also look for lip smacking behavior. More sleepiness, fussiness or tiredness than usual. Thirst. This is hard to tell in a small infant, but the lip smacking behavior or pursing her lips as if she is feeding may be a clue. Decreased urine output. Check an infant's diapers. They should need to be changed at least every 3 hours. If the diaper is dry after 3 hours, this may indicate some dehydration. Keep pushing fluids and check after another hour. If the diaper is still dry, call your physician. Check the color of urine. The darker the urine, the more dehydrated the baby or child may be. Constipation. Check for bowel movements as well, especially when you're checking the diaper for urine. Few or no tears when crying. Dry skin. Gently pinch the back of the baby's hand, just pinching the loose skin. Well-hydrated babies have skin that bounces right back. Dizziness or lightheadedness. Try coconut oil. Coconut oil has medium-chain fatty acids that have antiviral, antibacterial, antifungal and antiparasitic effects without having side effects. The main ingredient in coconut oil is lauric acid, a medium-chain saturated fatty acid. It inserts itself into the viral outer membrane and causes a rupture and death of the influenza virus without harming the human host of the virus. Take 1 to 2 tablespoons of coconut oil 3 times per day. Mix it in warm orange juice or take it with a meal. Usually within 1 to 2 days, the virus will be eliminated. Symptoms often disappear within 1 day, when normally it would have taken 5 to 7 days to recover from a flu. Method 4. Trying herbal remedies. Try drinking herbal tea. If you have them at hand, add 1 teaspoon of dried herb for every cup of water. Use half a teaspoon for children. Steep in boiled water for 5 minutes and flavor as desired with lemon and honey. Be sure to let the tea cool down. Avoid adding milk. Dairy products tend to increase congestion. Don't use these teas with infants, except under the advice of a physician. Try an herbal tea made from the following herbs. Chamomile. Chamomile is safe for children and has antiviral properties. Oregano. Oregano is also safe for children, but make it as a weak tea, and has antiviral properties. Thyme. Thyme is safe for children, as a weak tea, and has antiviral properties. Olive leaf. This is safe for children, as a weak tea, and has antiviral properties. Elderberry. This is safe for children, as a tea or as a juice, and has antiviral properties. Licorice leaf. Licorice leaf is safe for children, as a weak tea, and has antiviral properties. Echinacea. This is safe for children, as a weak tea, and has antiviral properties. Use a Neti Pot. A Neti Pot can be used to wash out a stuffy nose. It is a device that looks somewhat like a teapot. You use it to pour water into your nose to flush out your nasal cavities. Choose your essential oils. The herbs that can be used to make teas are also good choices for essential oil treatments. These include chamomile, elderberry, licorice root, echinacea, olive root, thyme and oregano. Combine an equal number of drops of your chosen oils. Add 6 tablespoons of finely ground unprocessed sea salt. Stir to dissolve the salt. The salt is included to help ensure that the nasal tissue is protected.